Hello everyone, good afternoon everybody. I am Sanya, your host from All About Skin Wellbeing team. I am sure all of you must be keeping good health. We all know taking good care of your skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is very common on your skin, on your nails, and fungal infection or mycosis are diseases caused by a fungus, yeast, or a mold. Mild fungal skin infection can look like a rash and can be itchy and annoying sometimes. So let's connect today with our skin expert, Dr. Sai Ragavendra Vikas, live from Hyderabad, to enlighten us on the topic of fungal infection. Dr. Sai Ragavendra Vikas is MBBS DDVL at Chaitanyapuri Skin Clinics, Hyderabad. Today, Dr. Sai Ragavendra Vikas will share us about fungal infection. Doctor, a very warm welcome.
Thank you and good afternoon to everyone. This is Dr. Sai Ragavendra Vikas, working as a consultant in Chaitanyapuri Skin Clinics, Hyderabad. Today, I'm here to answer a few questions about the fungal infections and the precautions to be taken regarding those infections.
Yes, and we are going to talk about the treatment, fungal infection, how it is prevented. But my very first question to you is, when we are talking about fungal infection, how we can define fungal infection?
Well, fungal infections are the infections caused by a fungus, which could be either a mold or any kind of dimorphic fungus. So most of these fungus affect the skin, nails, and also sometimes hair. And some fungal infections, which are very serious infections, they could affect any organ in the body and cause serious complications. So mostly in dermatology OPD, we encountered the superficial fungal infections called the dermatophytosis.
Okay, so this is basically the definition of fungal infection. Doctor, as you know that in India, monsoon have already come and, in monsoon, there are lot of cases of fungal infection. So is it like that a fungal infection can specifically happen in a particular season, or fungal infection is more in monsoon season and less in summer season, or it can happen in any season?
Usually in a tropical climate like India, fungal infections are rampant over the year, and mostly during the during summers and rainy seasons, where there is a lot of wetting of the body and clothes. In such conditions, the conditions are favorable for the fungal infection to grow on your body, and there is increase in the number of cases as most of these fungal infection are contagious. Usually you find these infections in more than 2 or 3 family members, that is in the same family. Because there is continuous sharing of the personal items like towels and soaps, it is easily spread among the family members and also sometimes among the friends.
Okay. And doctor, as we are discussing about fungal infection, if we go through what are the causes, or we want to know what are the various causes of fungal infection, why it is caused. It is, as you told us, about using soaps or personal items as well. So what are the different types of causes of fungal infection?
Well, fungal infections can affect any person, mostly those who are having any immunocompromised state, that is when their immunity is weak, like in diabetic patients and those are on immunosuppression medications like for cancer therapy and other autoimmune diseases. They are more prone for getting the fungal infections because in them the immunity will be very weak and they'll be easily get fungal infections when they are exposed to the very favorable conditions for the infections. And from there, they might be the source of infection in the family, and other family members can also get this infection from the infected person if they are sharing their personal items like combs, even towels, soaps, and even if they are washing their clothes in the same washing machine or in the same tumbler, there are chances of contamination of those water and other particles, and the other family members can also get the fungal infection.
Okay, so that means that fungal infection is contagious. If somebody is having fungal infection, we should, take care of these measures that, somebody is having fungal infection in our home or in our friends. We should be, aware of these things.
If any person in the family is he has got fungal infection, then his entire clothes have to be washed separately. His towel and soap should be kept separate. Otherwise, these are the common sources of the infection, and other person in the family can get infected with the fungal infection.
Okay, so you have to take care of these things, that if in your family somebody is having fungal infection, and usually, doctor, it is also prescribed that if somebody is having fungal infection, especially the towel that they are using, the clothes that they are using, it should not be used by some or the other people, and usually in friends, people share their clothes as well. So how it is important to take care of that factor?
Well, there are few tips to avoid the fungal infections, like do not walk barefoot in the showers, especially when there are any common bathrooms, or when, especially in hostels where a lot of students will be using common bathrooms. In such cases, people should not walk barefoot. They should either wear some slippers or any protective gear while using the common bathrooms, because the whatever the water which is contaminated will be the first source of infection. And if there are any cuts or anything on your foot, and the fungus will enter through these open wounds, and it may cause infection in the localized areas. And in such conditions, such fungal infections are called as tinea pedis. Or if the person who has been infected with fungal infection and has a common towel or soap, and other person in the family, if he uses that, and he might be getting the fungal infection in private areas or sometimes even on the face. When such person get infected on the face, it is called as tinea faciae. And if the person develops the fungal infection in the groin region, in such cases, it is called as tinea cruris or tinea corporis. And we should not keep common towels, even if we are sharing among the family members also. Everyone should keep their own towels separately, so that there will be lesser chance of transmission of the infection. And sometimes if the soap is used by many persons in the family, that has to has to be taken care, and separate soap has to be used for the person who got infected. And even combs should not be shared with other family members, because sometimes younger people, such as kids who are going to schools, and they might be having fungal infection in their scalp, that is called as tinea capitis. When such person who has got infected the fungus in the hair, if his comb is shared with other persons like parents, and there are chances that even the parents might get the infection in the scalp. And also precautions have to be taken care, such as wearing clean and dry clothes throughout the day, and avoid using underwears, especially during night time, because people will be wearing all these undergarments throughout the day, and those undergarments have become wet. And if this wet underwear is worn throughout the night, it will give a suitable environment for the fungus to grow. So every person should remember that while going to bed, they should remove their underwears and wear loose, breathable cotton clothes, so that there will be proper aeration, and whatever the sweat is present in the groin region gets dried off easily, and there won't be any chance for the fungus to grow. And also, one thing has to be remembered, that antibiotics can suppress the immunity, and they have to be taken very judicially, only under the supervision of the doctor. If you are taking antibiotics for a longer period of time, there is a chance of suppressing the growth of the normal commensals in the body, which causes the opportunistic infection by the fungus organisms. So proper diet, proper antibiotics have to be taken under supervision. Okay. And these are the few tips to prevent the fungal infection. And if these tips are followed, most 80% of the chances of getting fungal infection will be reduced.
Okay, that means taking proper care of diet, not using the towel as you have suggested, and not using the comb as well. ये आपने एक कुछ मतलब ये एक new thing है कि comb भी use nahi karna hai, because usually a family member use the same comb, but as you told us कि the comb also have some kind of infection, तो वो भी use नहीं करना चाहिए. It is good if somebody is having fungal infection, so not to use the comb as well. And you also told the different types of fungal infections. There are different types as well of fungal infections, so everybody has to aware of that as well. Doctor, when we are talking about fungal infection, so what are the treatments which are available for fungal infection as well? And if somebody is treating themselves, because usually कई बार ऐसा होता है, if my friend or some family member is having some or the other fungal infection, they go for home remedies as well. वो सोचते हैं कि ये वाला अगर क्रीम हमने पुट कर लिया तो हो सकता है फंगल इन्फेक्शन सही हो जाए, और वो हो भी जाते हैं, देन इट अकर अगेन. So what is your take on that? People taking home remedies or over the counter products?
Well, as I have mentioned earlier, immunosuppressant drugs such as steroids. Normally, the over-the-counter creams which are available in the medical shops, they are mostly steroid-based creams. That is, combination with few antifungals. In such cases, those creams will give quick relief and immediate relief. Once you start applying that cream, there will be reduction in the itching, there will be reduction in the redness and everything. But these creams cause more harm than treating the disease. What happens is when you apply a steroid cream on your skin, it will suppresses the immunity. That is, the immune response will be decreased. So immediately we will find relief from itching and also erythema. People will think that this cream has made wonders, and they start applying continuously for at least 3 to 4 weeks. During this time, because there is suppression of the immunity, the fungal infection grows into the deeper tissues, and it will become more difficult to treat with the conventional antifungals which are available. Normally, based upon number of lesions, that is, how many sites on the body it has infected, we either choose oral antifungals, or if it is limited to only very few areas, such as groins or only one lesion on the hand or any leg, then we go for only topical antifungals. But in most of the cases, it won't happen. Usually, patient doesn't turn with single lesion. They come with a extensive tinea. That is, they might have used steroid creams, which has caused extensive spreading of the fungal infection to other parts of the body. In such cases, oral fungals have to be given for at least 4 to 6 weeks. And especially in case of steroid abuse, that is, if the patients have applied the steroid-based creams more than 6 weeks, then there will be chances of developing secondary bacterial infection and deeper spread of the fungus. In such cases, we need to give oral fungals for longer durations.
Okay, that means treating the fungal infection by using the over-counter products and not going to a dermatologist is not suggested.
It's not at all advisable. And even few home remedies like application of garlic and other whatever Ayurvedic preparations which are available at home, they actually suppress the, it causes irritation and it will suppress itching. But that doesn't completely cure fungal infection. So fungal infection has to be taken care with oral or topical antifungals itself.
Right. So if you are having any kind of fungal infection, do visit a dermatologist, because it is advisable not to use over-the-counter products or home remedies. Doctor, also like to know that what are the various symptoms of fungal infection? How somebody can see changes in their body and can react with that this is particular fungal infection. How is the symptom started? Are there any different symptoms for different types of fungal infection as well?
Most of the cutaneous infections caused by fungus have common symptoms. The most common one being irritation of the skin, that is redness, followed by itching. Usually this kind of itch is present more during the night time when the patient goes to bed. While going to bed, he complains of severe itching, and that will even disturb his sleep. So to avoid those itching, patients tend to use any ointments or whatever it is available with them. So usually any fungal infection starts as a mild rash and it will spread to involve the entire part. And sometimes if you are scratching very heavily, this fungal infection gets lodges into your nails, and that will be the source, and it will act as a transport to the other parts of the body. Apart from itching and mild burning sensation, other symptoms are very rare.
So it varies from person to person, but itchiness and redness are the most common symptoms if somebody is having fungal infection can see. Okay, and doctor, when we are talking about fungal infection, if we talk about what is the most serious fungal infection in a person, what is the serious fungal infection?
Usually the dermatophytic infections are very mild. They are only limited to your skin. Rarely, mostly they won't spread it to the deeper organs unless you are using any steroid creams. Whereas whether other fungal infections might infect the other parts of the body like vital organs, and they might be very serious. But most of the cutaneous fungal infections are not serious. They are very mild.
Okay, so most of the fungal infection are mild and can be treated by a good, you're going to a dermatologist. It is good to go to a dermatologist rather than treating by yourself, because as doctor already mentioned that it is not advisable to use over-the-counter products or home remedies as well. Doctor, when we are talking about fungal infection, so is it safe to take the antifungals long term?
Usually, oral antifungals have to be taken for longer duration. But yes, I won't say that they are safer to use for longer duration, but under supervision by a doctor and regular investigations, they can be used for longer times, especially if required.
Okay, and here a point come, that if my fungal infection is getting better, I don't take the full medicine dose as well. Sometimes people, I think you might also come across many people that they see कि उनका fungal infection is getting better, they stop the medicine. What is your take on that? That it is advisable to stop the medicines if and not taking the complete dose?
No, usually this happened, and every time it happens in our OPDs. Soon after those symptoms like itching and erythema have gone, people stop using either topical or oral antifungals. No, that is not at all advisable, because fungus lodges in your skin for longer duration, and it takes minimum 4 to 6 weeks to be completely eliminated from the body. So you need to continue your oral or topical medications at least beyond 4 to 6 weeks. Because if we take treatment incompletely, these fungus grow back again, and the symptoms will reappear, and the infection will also spread to other parts of the body. So only under the supervision of the dermatologist or a doctor, it has to be continued for longer durations.
Okay, so do not leave your dose in between. Complete your dose, because it is very important, because fungal infection can come again if you did not complete your dose. Doctor, this is a very interactive session, and now we have some live viewers questions as well who are watching this live. So there's a question by Tisha asking, are there any specific precautions I should take when interacting with family members or pets during the treatment?
Yeah, you need to be very careful, especially with pets, because pets, if they have got infected with roundworm, then they become contagious, and animals like cats, dogs, and even cows, they are known to transfer ringworm infections to the humans. And in such cases, you need to check, if you are having a pet at home, you need to continuously check their skin if they are having any fungal infections. In such cases, you need to get them treated right way by a veterinarian, because animals cannot use the human antifungals, and they have to be treated in an appropriate manner by a veterinarian.
So that means the fungal infection can spread to the pets as well. If somebody in the family is having a fungal infection and they are, interacting with the pets, they can also develop fungal infection.
Yeah, human to animal transfer is rare, but definitely from animal to human transfer, we usually see in animal handlers, those who are continuously in contact with cows or any buffaloes. They are known to lodge this dermatophyte infections, and they are at risk of getting that infections.
Oh, Okay. And doctor, there's another question that is there any way I can prevent getting ringworm on my feet frequently?
Yes, those who are in an environment where there is continuous wetting of the feet, they're at risk of getting the fungal infection, especially the toenail infections, which is called as the tinea pedis, where even the nail bed get infected and there will be discoloration of the nails. In such cases, the nails become brittle and they are easily broken away. And patients who are, any person who is at swimming pools or any common toiletries, in such cases, he need to protect his foot by wearing covered footwear, like using a waterproof shoes or frequently mopping the floor to keep it dry, and also see that his skin is not broken so that there would be chance for the fungus to get into the feet and get infected. In such cases, you should avoid uh, walking on those floors barefoot. You need to use good equipment, that is latex boots or any waterproof boots, so that your feet are kept dry always.
Okay, okay. And doctor, as you told us that somebody is going to swimming or his or her work is more into water. So is water is a transmitter of fungal infection, because usually we see ringworm or cut on somebody's feet or hand as well, and those cuts can develop fungal infection. It is possible.
Yes, water is the main source of the transmission of the infection, because especially stagnant water. Stagnant water lodges a lot of fungi and which could be the source of infection. In such cases, not only water, even sweat, which usually when a person is sweating a lot, this sweat remains in the folds and it will act as a medium for the growth of the fungus. So water and sweat, both are a good source of fungus to transfer and also to get culture. They might form the food for the fungus.
Okay, so water and sweat, both are the things which are the causes of fungal infection as well. And
If they are
yes, yes,
if they are
yes.
present for longer duration on the uh, skin, like see, if water falls into pickles or sauces, there we usually uh, form their mold on the bread or on these pickles. Same, if there is a lot of moisture on the body or even if water on the body, there people usually develop the fungal infection.
Okay, and so preventing that, what is advisable to take bath after coming from work, or to take bath after swimming, because usually it is preferable that when you are going to swimming you should take a bath, or when you are in the rain, when somebody got went due to the rain, it is advisable to take bath. So taking bath is a good precaution method as well.
Yeah, precautionarily you can take bath, but every time when you step into the pool, you need to take a bath prior to that. But if you are having any kind of rashes or any kind of fungal infection, avoid going to swimming pools until it gets completely cured, because you might be the source of infection and that swimming pool might get infected, might be contaminated by you, and you will be the source of infection. In such cases, it is the duty of the person who has got this infection to avoid using the common bathrooms or swimming pools.
Right. And it is better for the other people, and being responsible is a good thing. If you're having any kind of fungal infection, don't use public toilets or go into public swimming pool because the fungal infection can be spread. Doctor, there is another question from a viewer asking, can I continue using my regular skincare products while undergoing treatment for a fungal infection?
Yes, definitely you can continue your regular regimen. Like if you are using any moisturizers, it can be continued, but see that they are not irritating the skin. And also sometimes if you are having any fungal infection on your face, and it might also be the source of transmission for the infection. If you apply the moisturizer and spread it to the other part of the skin, there are chances that the fungus also spreads along with this moisturizers. But most of the time it won't happen. And especially if you are using any sunscreen or anything, it might further irritate the lesion and you start scratching that. And this, once you start scratching, this fungus gets lodges in your nails and it will be the source of spreading to the other areas. So if you feel there is a lot of irritation, just apply a bland moisturizer. And I advise them to stop using any depigmentation creams on the whatever the fungal patch which is present. Usually people tend to apply these depigmentary creams like Fair and Lovely and all those things. Sometimes these creams might also flare up the fungal infection. So it's advisable to only apply moisturizer. Apart from that, do not apply other creams.
Okay, so moisturizer is the best cream you can apply if you're having any kind of fungal infection. Doctor, as you have mentioned nails, so nails are also a transmitter of fungal infection, and can, if somebody's scratching, somebody's having fungal infection on the hand, and he or she is scratching and then touches his face. So is it like that it can be transmitted through that as well?
It's the major transporting mode for the spreading of the fungus, because once you start scratching, whatever the fungus which is present on the superficial skin, it will be dislodged along with the scales on the skin and it will lodges into the nails. And once you put the contaminated hand on other part of your body, and it will be transmitting the fungus with that.
So that is taking to be care that if you're having fungal infection, you you take proper care of that as well. Doctor, there is a question coming from a live viewer that are there any specific hygiene practices I should follow to prevent fungal infection?
Yeah, definitely. Keeping separate towels, keeping your soap to yourself, and using body washes instead of common soap. These are the personal, most hygienic tips which I advise to every patient, because soap is the major source of contamination in a family. So if people start using any kind of body washes, there won't be any cross contamination. And if you keep the towel for yourself, the infection is limited to yourself and it is not spread to other family members. And also avoid wearing the same sporting equipment or same clothes or shirts, especially in siblings. That has to be avoided. They have to keep their own t-shirts to themselves and do not share them with their siblings or any other friends. And these are the few tips which by practicing, which you can prevent the spread of the fungal infections. Not only fungal infections, even other bacterial or any other parasitic infections can be prevented with such hygienic practices.
Right. So sharing is caring will not work in fungal infection. It is good that you love to share, but if you're having any kind of fungal infection, do not share your clothes or soaps as doctor suggested, your towel to anybody else. Doctor, there is a question coming from a viewer that are there any special consideration if I have a weak immune system or underlying health conditions?
Definitely. If you are undergoing any kind of immunosuppressive treatments, in such conditions, you need to be more extra careful. Avoid going to, if you have to travel for treatment purpose or anything, you need to carry your own towels, your own soap, and everything personally. Do not depend upon the towels which are available in the hotels or any other lodges. So that, because they might have been used by many people. And I doubt the hygiene maintenance by these hotel people, especially in lodges, where a lot of people might be using that linen and all those bedsheets. In such cases, because your immunity is very weak, you easily get those infections.
Yes. So
and yes, special care has to be taken, especially while using the personal things and also in diet. See, if you are eating outside food, it will further suppress your immunity, and there are chances that you might get the systemic infections also, especially candidal infections in immunosuppressant people. Whenever they are eating in unhygienic places, they might get oral candidiasis also.
Okay, and yeah, as you have mentioned that the food, if somebody is having weak immune system, the food precautions should also be taken. Are there any dietary precautions if somebody is having fungal infection should be taken in consideration?
Usually these superficial infections has nothing to do with that. I mean, there are no such things that if you eat masala, there will be increase in itching or anything. But definitely artificial colors which are added in these foods, they will increase the intensity of the itching because they have some allergic reaction in your body. And that time, the intensity of itching will go up and people start scratching more. Apart from that, there won't be any other diet restrictions, especially in home food. Everything, I mean, along with the medication, you can continue the daily food which has been cooked in the house.
As Doctor already mentioned, that there are no dietary precaution, but eating healthy is always a good thing because it can, if you are eating more spicy, the itchiness can increase more, right, Doctor?
Yes, especially spicy food and artificially colored food, it will increases the intensity of the itching.
Okay, okay. And there is another question coming from a viewer asking, is there any else I should be aware of regarding fungal infections and their treatment?
Fungal infections are most common and usually they are under noticed. I must say it is under noticed because people think that whenever they get any kind of itching, they usually feel shy to, even to show a doctor. Mostly they avoid that. Their groins are not at all involved, only it's the hand part which is involved. In such cases, if you do not give a proper history to the doctor, the treatment differs and it might take longer duration for the infection to be cured. So if you are having infection anywhere on the body, kindly do inform to the doctor so that he'll be giving the proper dosage of the antifungals. And also if topically, if you miss any kind of lesion on the body, it might also be the source of this further spreading of the infection. So you need to properly apply the infection creams or the oral medication which has been prescribed by the doctor on the all areas which are involved.
Okay, that means telling your doctor your proper history and if you are having any kind of health issues, sharing that with the doctor is very important.
Yes, definitely.
Okay, and doctor, there is another question from a viewer that what are the potential side effects of antifungal medications?
Definitely, few antifungals do have some kind of side effects, especially the oral ones. So the dose has to be adjusted according to the weight of the body, and also they need to be regular. They regularly need to get few investigations done at least for 2 to 3 weeks if they are using for longer duration, so that if there are any complications occurring, so these investigations help us to reduce the dosage or stop the medication and choose the alternative ones. And coming to the topical reactions or side effects which you might get with the topical antifungals are increase in the intensity of the itch. Sometimes their patients might develop allergy to the products or the preservatives which are present in the cream, and there will be flaring up of the itch. In such conditions, we usually choose the alternate preparations or give any kind of soothing creams like moisturizers to be applied along with the topical creams. Or sometimes we just increase the dosage of the antihistamine, that is the anti-itch medication, which we usually prescribe along with the oral and also topical antifungals. But most of these side effects are very minimal and they can easily be treated.
Okay, that means there are rare chances of side effects, and if there are any side effects, they can be treated. So this is not a thing to be scared of.
Definitely.
Okay, okay. And when we are talking about the antifungal drugs, can oral antifungal drugs can be taken during pregnancy?
Not all oral antifungals can be taken in pregnancy. Only few drugs can be, that is depending upon the stage of pregnancy and based upon other medications used during pregnancy and also the underlying condition of the mother. Few oral antifungals can be prescribed safely during the pregnancy.
Okay, and some of the antifungals can be taken during pregnancy. Doctor, there is a question that why the fungal infection occurs again and again. What are the reasons of fungal infections occurring again and again?
Okay. There are few reasons for a recurrence of the fungal infection. The first and the most important one being inadequate and inappropriate treatment. If you are taking inadequate dosage of antifungals, or if you are taking for inappropriate period, then there will be definitely relapse of the fungal infection. And sometimes if you are using any preparations which are having steroid mixed with that, and that might cause the relapse or the reinfection. And the third one is if any other person in the family is infected, and if he's not taking any treatment along with you, then he might be the source for the reinfection or the recurrence of the fungal infections. Sometimes if you are choosing a poor quality drugs, like if you are taking a cheaper ones or the lesser known medications, I mean, usually sometimes, especially with hydroconazole, the quality of the medication is very important for the curing the infection. If you are taking any poor quality drugs, and that too for the lesser duration, then there are definitely chances of the relapse.
Okay, so these are the different scenario due to which the fungal infection can occur again and again. And what antibiotics usually treat fungal infections?
Well, coming to the oral antifungals, we have very few options. The most commonly prescribed drug is the itraconazole, and the second one is the terbinafine, and the third one is the fluconazole, and rarely we use grisophulvin also.
Okay, so these are the different antibiotics which are available for the treatment of fungal infection. Doctor, any advice you would like to give to all the viewers watching this live video?
Definitely. This being a monsoon season and there is a lot of raining going on these days, I request all the viewers to carry their raincoats along with them if they are going on a two-wheeler. And I also ask them to prefer a car or any other public transport so that they won't get wet easily. If you are wearing wet clothes for longer duration, then you are at higher risk of getting fungal infections. And not only this fungal infection will stay for longer duration, it will also disturb your work, and it will also put at risk family members also at risk. So I sincerely advise you to carry a good raincoat and avoid going out during the rains. Either use a car or a public transport to prevent wetting also.
Okay, so that is very good advice that in monsoon season, do carry your raincoats and avoid going openly. Doctor, there's a question that how long do I need to take antifungal medicines? So there's a question that how long do I need to take antifungal medicines?
Usually based upon the number of lesions, if there are more than 5 lesions, that is extensive kind of tinea corporis, and the patient is not on any other immunosuppressants, we usually recommend it for 3 to 4 weeks. Sometimes we might also extend the duration of the oral antifungals by another 2 weeks to get the complete clearance of the infection. Whereas topicals, we usually continue them for longer duration. I mean, they double the time, at least for 6 to 8 weeks. Even after that, we usually prescribe some kind of medicated dusting powders so that whenever the patient is having sweating or anything, and these dusting powders, they usually absorb the sweat from this groin or other wet areas. And whatever the antifungal which is present in these dusting powders, it will prevent the growth of the fungus. So it at least takes minimum 8 weeks for the medication to act. I mean, we usually prescribe it for at least 8 weeks.
Okay, so
either
8
oral
weeks.
Or topical.
Okay, the oral or topical, 8 weeks is the time which is accurate if somebody has to take, and it can be increased according to the condition. Is it like that?
Yes, based upon upon the response and also the compliance of the patient, the duration of the medication varies.
Okay, so based on the duration and the fungal infection, it can be increased, but 8 weeks is a dose which everybody should take, and you should not miss the dose, as doctor already told that it is not advisable to leave your dose and your treatment in between as well. So doctor, we have discussed about the treatments of fungal infection, the types of fungal infection, the symptoms, and it has been a very informative session for all the viewers. So before we end this informative session, any takeaway message for all the viewers?
Practice good personal hygiene. Avoid sharing your personal clothes and personal equipment. Stay healthy, stay safe.
So practice good hygiene, stay safe, stay healthy is the takeaway message from Dr. M. Sai Ragavendra Vikas. Thank you so much, Dr. M. Sai Ragavendra Vikas, for your valuable time, and it has been a very quite informative session for all our viewers.
Thank you.
And doctor, we really look forward for many more such sessions in the coming time as well for our viewers.
Definitely.
And thank you so much to all the viewers for an excellent participation. For more information and updates on skin health and care, stay connected on our Facebook page, that is All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you and good day to all.